Hair loss is extremely common. It occurs in about 50 to 70% of men at any given course throughout their lifetime, and about 50% of women. Genetics is probably the largest component when we talk about risk factors for hair loss, but of course environmental stressors, certain underlying health conditions can also contribute to hair loss. Hair loss, depending on the type, can happen at all different stages of life. Androgenetic alopecia, also known as pattern hair loss, happens more commonly starting in the 4th and 5th decade, but there are other forms of hair loss such as alopecia areata that can happen at younger ages starting in childhood. There are a varied amount of treatment options available for hair loss. The first step is to figure out the exact type of hair loss you're experiencing so we can tailor that treatment appropriately towards your specific type. Some of the treatment options include PRP injections, finasteride, minoxidil, otherwise known as Rogaine. So we have a ton of different treatments, and it really does depend on the specific type of hair loss. Hair loss is extremely common. It's something that many people experience throughout their lives. It's nothing to be embarrassed about, but it is important for patients to come in to see us as soon as they really notice that hair loss to start, because the best way we can treat hair loss is if we catch it early.